For many people, cancer is thought of as a sudden event, a diagnosis that appears without warning, often explained by genetics or chance. This belief is common, but modern medical science suggests it is incomplete. Current research shows that cancer is not a single moment in time. It is a biological process that develops gradually, often over many years. Throughout life, the body's cells are constantly dividing, repairing, and renewing themselves. During this process, small abnormalities can occur. In most cases, these changes are identified, controlled, or eliminated by the body without ever causing symptoms. What matters from a scientific perspective is not simply whether abnormal cells appear, but how the body responds to them. In many individuals, natural regulatory systems are able to maintain balance and prevent these changes from progressing into disease. This understanding does not minimize the seriousness of cancer, nor does it dismiss the importance of genetics or medical treatment. Instead, it reframes the issue. It shifts attention toward the internal biological environment, the systems that monitor, regulate, and stabilize cellular behavior over time. The key question, then, is not why do abnormal cells exist, but rather, what determines whether they remain controlled or begin to progress? Answering this question requires careful examination of well-established biological mechanisms, grounded in evidence, not fear, and it forms the foundation for a more accurate, science-based discussion of long-term health. Public understanding of cancer has been shaped largely by simplified explanations in emotionally charged narratives. Over time, this has led to several common misconceptions that persist despite advances in medical science. One widespread belief is that cancer is primarily determined by genetics. While inherited genetic mutations can increase risk for certain cancers, large-scale epidemiological research shows that most cancer cases are not directly caused by hereditary factors alone. Many individuals with known genetic risks never develop cancer, while others without such risks do. This disconnect often leads to confusion about what truly influences cancer development. Another common misconception is that cancer appears suddenly and unpredictably. This view is reinforced by the moment of diagnosis, which can feel abrupt to patients. However, diagnosis reflects detection, not the beginning of disease. The biological processes involved typically unfold over long periods, often without noticeable symptoms. Lifestyle factors are also frequently misunderstood. Nutrition, physical activity, and overall health behaviors are sometimes portrayed in extremes, either as miracle solutions or as irrelevant once genetics are involved. Neither perspective aligns with current evidence. Research suggests that lifestyle factors influence biological systems related to cancer risk, but they do not act in isolation or provide absolute protection. Confusion is further amplified by how scientific findings are communicated. Observational studies are often reported without clarifying their limitations, while laboratory findings may be generalized beyond their intended scope. This can blur the distinction between association and causation. As a result, many people are left with fragmented or conflicting messages. Clarifying this context is essential before examining the evidence itself. A balanced understanding requires separating established knowledge from ongoing research and avoiding conclusions that go beyond what the data can support. Scientific understanding of cancer is grounded in decades of epidemiological research, clinical observation, and experimental study. Rather than viewing cancer as a sudden event, modern medicine recognizes it as a process that often develops over extended periods. Post-mortem and imaging studies published in peer-reviewed journals have documented the presence of small, localized clusters of abnormal cells in individuals who never showed symptoms of cancer during life. These findings have been reported in tissues such as the prostate, breast, and thyroid. Importantly, most of these microscopic findings never progress to clinically significant disease. This observation has been widely discussed in medical literature as evidence that abnormal cellular changes alone are not sufficient to cause cancer. According to the National Institutes of Health, cancer development typically requires multiple biological changes over time. These include genetic alterations, changes in cellular regulation, and shifts in the surrounding tissue environment. No single factor has been shown to independently explain cancer progression in most cases. The World Health Organization identifies cancer as a multifactorial disease influenced by age, environmental exposures, immune function, and chronic inflammatory states. WHO reports emphasize that cancer risk exists on a continuum rather than as a binary condition of healthy or diseased. Research supported by the Centers for Disease Control and Prevention highlights the role of immune surveillance, the ongoing process by which the immune system identifies and removes abnormal cells. This mechanism has been observed across multiple cancer types and is considered a fundamental aspect of cancer biology. Another well-established area of evidence involves angiogenesis, the formation of new blood vessels. Clinical and laboratory studies have demonstrated that tumors require blood supply to grow beyond a limited size. This mechanism is sufficiently validated that anti-angiogenic therapies are used in standard cancer treatment. It is important to note the limitations of this evidence. Observational studies describe associations, not guarantees. Biological mechanisms explain possibilities, not certainties. Individual outcomes vary widely based on genetics, environment, health status, and access to medical care. Taken together, the evidence supports a probabilistic model of cancer development, one based on likelihood and interaction rather than inevitability. Understanding cancer risk requires examining how several core biological systems function and interact over time. Research does not point to a single mechanism, but rather to a network of regulatory processes that influence whether abnormal cells remain controlled or progress. Immune surveillance. One of the body's primary protective systems is immune surveillance. Specialized immune cells continuously monitor tissues for signs of abnormal behavior, such as damaged DNA or irregular cell division. When these cells detect abnormalities, they may eliminate the affected cells or signal for repair processes to occur. This function is well established in immunology and oncology. Importantly, immune surveillance does not operate at a constant level throughout life. Age, chronic illness, sleep disruption, and prolonged physiological stress can influence immune efficiency. A reduction in immune effectiveness does not automatically lead to disease, but it may alter how consistently abnormal cells are recognized and managed. Inflammatory regulation. Inflammation is another central mechanism. Acute inflammation is a normal and necessary response to injury or infection. It facilitates healing and immune defense. However, when inflammatory signaling becomes chronic, the biological environment changes. Persistent inflammation can influence how cells respond to growth signals, how DNA damage is repaired, and how tissues regenerate. Scientific reviews describe chronic inflammation as a condition that may increase susceptibility to cellular dysregulation. This does not mean inflammation directly causes cancer, but it may create conditions in which abnormal cells are more likely to persist or expand. Angiogenesis control. All cells require oxygen and nutrients delivered through blood vessels. Under normal conditions, the formation of new blood vessels is tightly regulated and occurs primarily during growth, wound healing, or tissue repair. Cancer research has demonstrated that abnormal cells may produce signals that stimulate new blood vessel formation, a process known as angiogenesis. Without access to additional blood supply, clusters of abnormal cells are limited in size. When angiogenic signaling becomes active, these limitations may be removed. This mechanism is sufficiently established that angiogenesis has become a major target in cancer treatment. Its relevance in cancer biology underscores the importance of vascular regulation as part of the broader disease process. System interdependence. These systems, immune surveillance, inflammation control, and vascular regulation, do not function independently. They communicate through chemical messengers, feedback loops, and regulatory pathways. For example, chronic inflammation can influence immune signaling, potentially altering how effectively abnormal cells are identified. Changes in vascular function can affect tissue oxygen levels, which in turn influence cellular metabolism and stress responses. Immune activity itself can shape inflammatory signaling and tissue repair. Cancer biology increasingly adopts a systems-based perspective, recognizing that risk emerges from interactions among these processes rather than from isolated failures. Limits of mechanistic understanding. While these mechanisms are well supported by evidence, they describe tendencies rather than outcomes. Not every disruption leads to disease, and not every cancer follows the same pathway. Individual variation is significant, influenced by genetics, environment, and overall health. Mechanistic explanations help clarify how cancer can develop, but they do not allow for precise prediction in individuals. This distinction is critical for maintaining scientific accuracy and avoiding deterministic conclusions. The biological mechanisms discussed earlier help explain how long-term health patterns may influence disease risk at the population level. Rather than producing immediate effects, these mechanisms tend to operate gradually, shaping health trajectories over years or decades. Large observational studies indicate that chronic inflammatory states, reduced immune efficiency, and metabolic imbalance are associated with higher incidence of several chronic conditions, including certain cancers. These associations are probabilistic, meaning they describe trends across groups rather than outcomes for any single individual. From a public health perspective, this distinction is essential. Risk does not equal destiny. Many people with elevated risk factors never develop cancer, while some individuals with few identifiable risks do. However, when examined across large populations, patterns emerge that inform prevention strategies in health policy. Long-term health impact is increasingly evaluated through the concept of health span, the length of time an individual maintains functional capacity, independence, and quality of life. Research suggests that biological systems involved in immune regulation, inflammation control, and vascular health play roles not only in cancer risk, but also in cardiovascular disease, metabolic disorders, and age-related decline. This broader view highlights why cancer prevention cannot be isolated from overall health maintenance. Strategies that support regulatory balance within the body tend to influence multiple outcomes simultaneously. For example, reducing chronic inflammation is associated with improved mobility, cognitive function, and resilience in later life, in addition to potential effects on disease risk. Importantly, medical authorities emphasize that these findings do not replace established cancer prevention measures. Screening programs, vaccinations, occupational safety, and access to timely medical care remain central to reducing cancer-related mortality. The long-term impact of biological regulation should therefore be understood as supportive rather than definitive, contributing to healthier aging and reduced disease burden at the population level, without implying certainty or control over individual outcomes. Within mainstream medicine, there is broad agreement that cancer prevention and management require a comprehensive, evidence-based approach. No single factor is considered sufficient on its own to explain cancer development or prevention. Major health organizations, including the World Health Organization, emphasize that cancer risk arises from an interaction of non-modifiable factors, such as age and genetic background, and modifiable factors, such as environmental exposures and overall metabolic health. These organizations consistently caution against oversimplified explanations or single-solution narratives. The National Institutes of Health and other national research bodies recognize immune regulation, inflammatory processes, and vascular signaling as important components of cancer biology. However, they also stress that these systems influence risk in a probabilistic, not deterministic manner. Clinical practice guidelines developed by oncology societies and public health authorities prioritize early detection through screening, vaccination, where applicable, and evidence-based medical treatment. Lifestyle-related factors are addressed as supportive measures that may contribute to general health and resilience, rather than as therapeutic interventions. At the same time, experts acknowledge areas of ongoing scientific debate. For example, research into diet patterns, gut microbiota, and long-term immune modulation is active and evolving. While early findings suggest meaningful associations, professional consensus holds that these areas require further large-scale clinical trials before definitive conclusions can be drawn. Where evidence is insufficient, official recommendations explicitly state uncertainty. This commitment to transparency is a defining feature of consensus medicine and helps distinguish established guidance from emerging hypotheses or health trends. From a public health standpoint, the application of scientific knowledge must remain cautious, proportional, and clearly bounded. The goal is not to prescribe individual actions, but to outline general principles that support population-level health. Health authorities consistently emphasize the importance of maintaining overall physiological balance. This includes supporting immune function, minimizing chronic inflammation, and promoting metabolic stability. These objectives are addressed through well-established lifestyle foundations, such as balanced nutrition, regular physical activity, adequate sleep, and stress management. Importantly, these principles are not presented as disease treatments. They are framed as risk-modifying behaviors that may contribute to long-term health when sustained over time. Their effects are cumulative and variable, and they operate alongside, not in place of, medical care. Public health guidance also stresses the importance of preventive services, regular cancer screening, age-appropriate vaccinations, occupational and environmental safety measures, and timely access to healthcare services remain central components of cancer prevention strategies. Individuals are encouraged to view health decisions as part of an ongoing dialogue with qualified healthcare professionals. Personal medical history, family risk, and existing conditions all influence appropriate choices, and these factors cannot be addressed through generalized guidance alone. By focusing on evidence-based principles rather than specific prescriptions, public health approaches aim to empower individuals with knowledge while preserving safety, flexibility, and medical oversight. Cancer is best understood not as a single event, but as a long-term biological process shaped by many interacting factors. Modern medical research shows that risk develops over time and reflects the balance of multiple regulatory systems within the body, rather than any single cause. This perspective does not offer certainty, nor does it promise control over outcomes. Instead, it provides clarity. It helps explain why individuals with similar risk factors may experience very different health trajectories, and why prevention and treatment must be approached with nuance and evidence. From a health perspective, the most constructive response is neither fear nor false reassurance. It is informed engagement. Understanding how the body maintains stability through immune regulation, inflammatory balance, and tissue health supports a broader view of long-term well-being. Medical science continues to evolve, refining how risk is assessed and how prevention strategies are designed. What remains consistent is the value of evidence-based thinking, professional guidance, and sustained attention to overall health. Empowerment comes from understanding probabilities, not promises, and from making decisions grounded in credible information, realistic expectations, and long-term perspective. This content is provided for educational and informational purposes only and is not intended as medical advice. It does not diagnose, treat, cure, or prevent any disease. Health information and scientific understanding evolve over time, and individual health circumstances vary. Viewers should not use this material as a substitute for professional medical evaluation, diagnosis, or treatment. Always consult a qualified healthcare provider regarding personal health concerns, screening decisions, or changes to diet, lifestyle, or medical care. The information presented reflects current evidence-based understanding, but does not replace clinical judgment or established medical guidelines.